Does your Achilles scream every time you go for a run or a walk? Or maybe you feel like if you are walking up and down stairs, like your Achilles is going to rupture and you're really concerned about what you can do about it. You may be considering surgery because you feel like that's going to be your only option. Before you rush into surgery, watch this video to learn tips that you can use at home to deal with your Achilles pain. Because the truth of the matter is you're dealing with a real injury. It's not just sore. First off, we're going to cover what is Achilles tendinopathy because it's important to know what we're actually talking about if this video is right for you. Next off, we're going to discuss the common signs that come along with that, as well as who's most affected, and then we'll get into my top tips of what to do for Achilles tendinopathy. The first thing that I want you to hear is that Achilles pain is not something to just work through or walk through or run through. The Achilles tendon is critically important and it can actually snap. And often if it does snap, you may become a surgical candidate. So I really want you to take your Achilles tension or your Achilles pain very seriously because we don't want you to get to that point. But understanding the root cause of your pain is important because that's going to help in your healing journey. I'm Dr. Amy, PhD trained orthopedic manual physical therapist, and I believe that movement is life because every tissue in your body is designed to heal itself as long as it's moving correctly. And this story of Achilles tendonitis is very personal to me because when my husband and I were training for the stupid long race, also known as the Dopey that we did in 2025, he started to have some Achilles tension that he thought he could just stretch out. So he didn't tell me about it until he had been training pretty hard for about a month. Well, by the time I got him into the clinic and actually did an evaluation, when he laid down on the table, through his skin, I was able to see a line from where his Achilles tendon started and the muscle stopped. Now, friends, this is concerning. You should not be able to see a line on the back of your calf from where your Achilles tendon starts. So he was not far away from a complete rupture, which would have ended his Dopey career. Now, I'll tell you at the end what we did to actually heal it. Today, I want to keep you from being in that situation in the first place. So first thing we need to discuss is what's the difference between Achilles tendonitis and an Achilles tendinopathy. So basically, an Achilles tendonitis is a recent onset and is an inflammatory condition. So this means that the body is in the process of trying to heal it. This is usually within the first couple of weeks that you may feel some redness, heat, there may even be a little bit of swelling in that area, and that's a sign that your body is actually trying to heal it. That is a tendonitis. However, a tendinopathy is when you're already past that phase, so you're usually past those 3 weeks, and the body has stopped actively trying to heal that area. What's happened is it's laid down scar tissue and it's just said, okay, that's good enough for right now. The concern here is that that tendinopathy is no longer being actively healed by the body. You can think of it as a tendinitis is more that acute. Again, that first 1 to 3 weeks. A tendinosis is usually more chronic and it can start at about 3 weeks, but if you've been dealing with this tension for more than 3 weeks, chances are good that it has turned into a tendinosis at this point. So what causes an Achilles tendonitis or a tendinosis? Most commonly, there's a sudden increase in activity. So that's what we saw in our case, that my husband and I started training for 48.6 miles in 4 days. So he ramped up his training. Now, he did not do a sudden increase. We had a very clear training plan and it shouldn't have been a problem, but the confounding factor for him was that he increased his training and didn't do anything in the in-between. You see, he sits at his desk all day long and he would sit all day and then run in the afternoons with no opportunity for really any movement. If you have tight calves already, you're going to be more predisposed to an Achilles tendonitis, but also if you have weak glutes, because that puts too much stress on those calf muscles and you're not activating your glutes enough while you're doing activity. It can equally be coming from below as it can from above, in that you may not have the proper footwear for your foot and for your activity. And this is especially true if you train on really hard surfaces. So if you're someone who does like a court sport like basketball, or you're on a tennis court, those surfaces tend to be hard and you need to make sure that you have the cushion in your shoe that's required for your foot. And I'm going to go down a little bit of a rabbit hole here because people often ask me what the best shoe is for this activity and for my foot. And the thing is, the answer changes based on your activity and your foot. So in a YouTube video, I can't address every single activity and every single type of foot, but what I can do is I will include a link below to the running shoes that my husband uses with very high arches and the running shoes that I use with very flat feet. Now, another cause of tendonitis can be overuse without proper rest time in between, or without proper transition time in between. As I mentioned, my husband went from sitting to running. He's not really into walking very much. And that was a big part of his rehab that I needed him to add in that in-between space. You can't just sit and then run. Like, we need to have some walking, some moving about. And obviously, if you have any predisposition and you also may have some biomechanical issues that are putting increased stress on the Achilles tendon. And this shows up a lot when people are starting a new activity. So they may have already had this biomechanical issue in their foot or their knee or their hip, but then they start doing a new activity or returning to an activity that they did a long time ago, like 10 or 20 years ago, thinking that everything's going to be fine because they could do it in the past. However, in the in-between times, there may be a biomechanical issue that has showed up. So for instance, this could be that their foot is not moving correctly, but they don't notice it because they're walking, sitting, just doing daily activities. But when they ramp up their activity level, they start to notice this change in the Achilles tendon. So if you've recently returned to an activity that you did previously or upgraded your training plan, this could be why you're starting to feel that tension in that Achilles tendon. And let's talk about what I'm talking about with the Achilles tendon. So you have two muscles that are in your calf. So your calf is that area of your leg that's in between your ankle and your knee. And the muscles are the gastrocnemius and the soleus, which are on the back. So if you put your hand underneath your knee and you feel that big muscle back there, that's the gastrocnemius. Underneath it is the soleus. Now, these two muscles attach onto what's called the Achilles tendon and wrap down right below the back of the ankle and actually attach to the bottom of the foot. It's a pretty long tendon in all honesty, and it is the tendon that's most commonly snapped when you're doing regular activities. Now, there are other tendons that can get snapped, but that tends to be more with a fall or an aggravation like that. The Achilles tendon actually can snap just with doing regular activity like playing sports or running or other forms of exercising. But it's not actually the activity that causes it to snap. It must have already been tight, and then you did the activity and that caused it to snap. So we see this a lot in professional athletes. And obviously they haven't upgraded their training program recently. However, they are performing regularly, and most likely their bodies do not have a chance to rest in between, or there may be a muscle imbalance or weakness that leads to that Achilles tendon rupture. With us normal people, it tends to happen often when we're between our 30s and our 60s, and most commonly what I see is people who have recently returned to a previous activity. And what I see most commonly is people who used to play sports when they were younger, who are returning to it in their older years, and who just have changes in their bodies that have happened over time. I also see it a lot in those weekend warriors. So people specifically who sit a lot for work and then on the weekends go out and do a whole bunch of activity. And again, there's no in-between space for their body. It's either sitting or some high intensity activity that can lead to some challenges to the Achilles tendon, which could potentially rupture it or cause it to become tight. And one of the most often overlooked things that can cause an Achilles tendon rupture or Achilles tendon tension is a previous injury that did not heal correctly. So if you have a previous history of ankle or knee injuries that you thought healed correctly because you could get back to your regularly scheduled programming, but now you're trying to up your training or you're adding a new activity, it may not have healed completely enough for the thing that you're trying to do. So how do you know if you have an Achilles issue that may eventually lead to a rupture? Well, you'll have pain or stiffness in the Achilles area. So this is the area that's in your lower calf and it wraps around and attaches into the back of your heel. So many people think, wait, is this heel pain when you're getting up in the morning? So if you have heel pain when you first put your feet on the floor, most likely that is actually a plantar fasciitis. An Achilles tendonitis pain is going to be felt more on the back of your heel as opposed to the bottom of your heel. With Achilles tendonitis or tendinosis, you will often have pain with walking, going up and down stairs, and things like running or higher level sports. You often will be tender to the touch of that Achilles tendon. So you can put your fingers on the back of your heel, and often it will be tender back there. Most likely then you do have an Achilles tendonitis. And if you feel the back of your heel and it is tender, you can check the other side to see how that one feels. And you may notice that the one that's tender is also swollen or thickened, whereas swelling indicates more of a tendonitis, the thickening indicates more of a tendinosis. And here's the tricky one. A lot of people with an Achilles tendonitis have pain when they start running or start doing their activity, but it gets better as they do their activity and they warm up, because the muscles that are attached, so that gastrocnemius and that soleus, get warmed up, they get some blood flow, and things start feeling better. Then after you do the activity, maybe you have to sit in the car for a half hour to drive home, things really tighten up and it's way worse when you get out of the car, or if you're sitting for any prolonged period of time after doing the activity. Okay. So I promised to tell you what we did to heal my husband's Achilles tendinosis, and we're going to get to that in just a second. First, I want to give you some tips that you can use at home to manage and heal your Achilles tendonitis. The first one is that you need to avoid the aggravating activities. Now, if you're having pain with everything, including walking and standing, I understand that this is going to be difficult. I don't want you to sit and not do anything for weeks on end, but I want you to avoid any activity that increases that sensation of tension. So we call this a relative rest. We want to rest from aggravating activities, but please don't rest from all activities, because again, movement is life, and every tissue in your body is designed to heal itself as long as it's moving correctly. Now, once that tendon calms down and becomes less tight and painful, you do need to do some progressive loading exercises. So we need to start getting you back to your previously scheduled activities. Along with that, we also want to do some calf stretching to make sure that the muscles in the calf are able to contract and relax properly, which will decrease tension on the tendon. Now, if your calf muscles feel tight and you feel like you can't stretch them very well, something like a Theragun or something to help with some self-massage of that calf can really help to decrease the tension in the muscles. Now, you may be asking yourself, well, can I use the Theragun on my tendon? Now, I actually don't like to use something aggressive like a Theragun on a tendon because I feel like it's too much force through a tendon. Let me explain that. A Theragun provides a lot of input into a tendon or a muscle, whatever you're using it on. However, muscles have really good blood supply. So you use the Theragun and you get that knot worked out, the body is able to respond by providing blood supply to help heal that area that has now been traumatized. But tendons do not have really good blood supply. So you use the Theragun on the tendon and the tendon gets inflamed. It's much harder for it to heal because it doesn't have that direct blood supply. So although I love Theraguns or anything like it on the muscles, so the gastroc and the soleus, those big calf muscles, I don't recommend it for tendons because it tends to be a little bit too aggressive. If you insist on using it and you feel like it is helpful for your tendon, just limit the amount of time that you're actually over the tendon. If your Achilles tendonitis or tendinosis started when you increased your activity level, then I definitely recommend reevaluating your footwear, because it could be that your foot's trying to tell you, I am not properly supported for this activity. We want to make sure to address any biomechanical issues. So if that foot is not moving correctly, if those glutes are not activating properly for the activity or lifestyle you want to live, we want to make sure to get those addressed so that your body can move freely through your regularly scheduled activities. And now, potentially the most controversial question, do I use ice or do I use heat? If you're suffering with an Achilles tendonitis, so where it's red, hot, inflamed, I recommend putting ice on it for 5 minutes a few times per day. This will help to decrease the inflammation and allow that tendon to move more normally. In general, I'm not a big fan of heat, and particularly with an Achilles tendonitis. Here's why. If you add heat to the muscles or to the tendon, that means it's going to be able to stretch better, which sounds like it would be good, except for now that muscle may be able to stretch further than it biomechanically is capable. This leads to microtrauma and micro tears, which leads to scar tissue formation. And scar tissue is not normal tissue, which means it does not move correctly. But try it out for yourself. Put your heating pad away for 1 week, try these other suggestions, and let me know in the comments below how you feel after not heating your Achilles tendonitis or tendinosis for 1 week. Did it make your symptoms better? All right. So what did we do for my husband? Well, we implemented all of those strategies with my husband that I already mentioned, in addition to the fact that we did some regenerative medicine on him. So we implemented our Shockwave protocol to help decrease tension in the gastroc and soleus, improve blood flow to those muscles, as well as do some targeted focused treatment right on that Achilles tendon to help it actually be able to heal. And in only 6 weeks, mind you, he continued his training during this entire time because he's a man and he's a little stubborn, which included long runs between 14 and 20 miles. In only 6 weeks, that line I mentioned at the beginning of the video that I could see in his skin between the muscles and the tendon literally disappeared. His tendon became more mobile. Pain went away. He was able to stretch more effectively. And after those 6 treatments, which again, we did while he was training, he's never had a problem with that Achilles tendonitis again. And I will tell you that as we're recording this, we are a year past when we did that treatment. Now, I will also tell you that he ended up having an Achilles tendonitis issue on the left side, but we addressed it earlier because he had seen the good results on the right side, and that one only took 3 treatments. And that's while we're training, and that's also while we're training for our next stupid long race. So, what's the major takeaway here? 1, please don't wait as long as my husband did to seek help. Try these tips that I recommended in this video for 1 to 2 weeks. And if you're not seeing a marked change in your Achilles tendonitis, or if you feel like you have tendinosis and these tips are not working for you, I want you to seek out help from a specialist, particularly a manual physical therapist who can figure out not only what's going on with your Achilles tendon, but also understand how this problem came to be in the first place. And if you have already been to traditional physical therapy and not gotten the results that you were looking for, I would definitely encourage you to learn more about regenerative medicine. This is technology that actually uses pressure waves to get into the muscles, tendons, joints, and ligaments to actually help them heal from the inside out. So this problem never bothers you again. Now, if you're not in the Maple Valley, Washington area, I'm going to include a phone number below of somebody that you can call to find a regenerative specialist near you. Don't forget to like and subscribe to our channel to learn more about how your body works. And if you believe that your Achilles tendon issue is coming from a knee problem, I'm going to have you check out this video over here where I'm going to show you some self-massage techniques for your knee.